Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
I am Gerard Chiche, and I am going to give you my practice inspiration. We really advocate for our patients whenever we can conservative veneers, but the question is, with the interest today about no prep veneers, really is there such a thing as a no prep veneer? So we're going to look first at what the veneer needs, what the porcelain needs. And it all depends how discolored the preparation is. So if you have a preparation that is not so discolored, really you're looking at about a little bit over 0.5 millimeter of thickness needed for the porcelain veneer. It's a little different when you're looking at a more moderate, slightly more intense discoloration. You're going to be looking at adding about 0.2 millimeters to those values. So in the center of the veneer, you probably would be looking at 0.7 or 0.8 millimeters. So for example, you take that patient and she wanted to enhance her smile, and we're only going to do 4 veneers. And I want you to notice the axial inclination of the centrals and the canines. They're very tipped in. The centrals are retrusive, the canines are torqued in. And the wax up is entirely additive. There is absolutely no preparation planned. And when you look at the patient completed with those 4 veneers, we left the lateral incisors alone. You can see that she's very happy, but you see one first principle that always we have to bear in mind when we do conservative veneers, and that is we need to maintain the harmony with the lower lip when the patient says 45, when the patient wants to function. So that's the easiest case you could ever have. The teeth are very, very retrusive. This is a young lady who is going to undergo orthodontics and also some crown lengthening. And as the treatment unfolds, we notice that the central incisors are under-contoured. They're a little bit undersized, and yes, we could probably be additive. Then we looked at the upper lip, and we see that it's pretty thick, and the maxillary teeth look a little bit to the back, a little bit retrusive to some degree. So those are the preparations. You're looking at them. All we did was reduce the line angles a little bit, and then from there we made the final impression. So this is where another great indications of low prep veneers is undersized plus retrusive incisors. And at the end, when you look at the patient completed and you compare the facial pictures before and after, the idea is that definitely there is a certain lip tolerance when we do low prep veneers. We can challenge the lower lip. As long as the lower lip will accommodate the additional volume we create, then we have an opportunity for being conservative. So then we look at maybe a little bit more restrictive, because you're looking at a patient here, the teeth are not retrusive at all. She has a little bit of undersizing, and those are cases where if the patient really demands very, very conservative veneers with no preparation because she heard about it from any source out there, then there is some homework that is needed. The homework is a additive wax up where arbitrarily we are going to augment the volume by approximately 0.5 millimeter, and we're going to go beyond the canine. It's important you go to the bicuspids because you need to create a certain equalization between the new volume you add in the front and the volume you add on the side. Then we make a very precise impression with a silicone index. You notice we cut the palate, we're going to create escape grooves, and then we load the impression with integrity. It's a very convenient material to use, it's easy to peel off later, but just for that appointment, we are showing the patient the template of the future veneers in terms of the volume and against the lower lip. And there are a lot of advantages because we can be conservative, but the patient, the lip, have to tolerate the new volume. And you can see here it's working out very well. So you do have some homework as you have more restrictions, which I mean less retrusion, less undersizing. You have to have a precise wax up. It has to be a precise technique from a PVS impression. And you need an aesthetic trying to test the aesthetic possibilities and to make sure that that lower lip that you're challenging tolerates your treatment. So from there, what we're going to do, because we're trying to stay in the no prep mode, we're going to do a very precise matrix. That's going to be a silicone matrix that's as rigid as possible. Example, Siltec Putty by Ivoclar. And that's the typical horseshoe shape of the matrix. But then I want you to see how we're making our cuts so that we can see at a level which is approximately halfway between the gingival and the incisal of the incisors, essentially. Now we need to keep that rather bulky, and then we are going to place it over the unprepared teeth. And the question is, do we have enough room to fabricate no prep veneers? And you see right away where the interferences are, right on the line angles, as I told you. So is it enough? Do we just adjust the line angles? As you can see, we mark them and we go back and forth, move the matrix back and forth. Not exactly, because the beauty of veneers comes from the position of the line angles and also the embrasures. Look at the labial embrasure of the central incisors and ask yourself, do I have enough room to create my labial embrasures? The answer is yes for the central incisor, but no for central to lateral embrasures. So now you see, in fact, exactly the cut we're going to do. We're going to not only reduce the line angles, we also are going to reduce inside the contact into the embrasure. So really, most of the time, there is no such a thing as a no prep veneer unless you are willing to settle for very fat teeth. The beauty of veneers come from the line angles and from the beautiful incisal separation from the facial aspect. And if you can have those, then you will have happy patients. Now, in terms of finish line, because this is a question that is very often asked, is do we put a finish line no matter how conservative we are with these? And the answer is yes. We're going to use the Comet or Brasseler 8392 016. This is a tiny mosquito diamond burr that will essentially run on the cervical aspect of the preparation, if there is such a thing that you want to call a preparation here. But the idea is it's more like a line of agreement with the ceramist. In addition, we are going to reduce slightly the line angles as we talked about. So if you go into the embrasure, it's going to be essentially that triangle that is on the mesial aspect. And finally, my advice is for canines, even if you plan no prep veneers, for canines, tuck them in a little bit, round them in, because you do not want a straight canine. It's very fangy, and it can really interfere with the lower lip. And the last case I want to show you is what could connect what I showed you so far, the progression from no prep to low prep to a little bit less low prep, and the connection to the traditional veneer, but we're not going to do traditional veneers. We're going to still say lower prep. When you see patients who have a lot of functional problems, and yes, indeed, we could have an ideal treatment with orthodontics, we could consider opening the vertical dimension, but frankly, the budget is limited and the patient only desires limited treatment. you still have a way to deliver to the patient the aesthetics they would like with a certain measure of protection. So you look at this very young boxer, and we're going to use the same principles. We're going to arbitrarily create an additive wax up. And you notice it goes all the way to the at least first bicuspids, if not second bicuspids, whenever you can. And we're going to try it in. And if the patient likes the aesthetics, you know there is a much better flow and there is better volume in the buccal corridors. If the patient likes the aesthetics better, then this is a template of agreement. We're going to remove it that first appointment. And then we're going to put it on the day of veneer preparations. That's another patient in the bottom, but you see this exactly the same situation. And we're going to use it as our template for preparations. So if we added 0.5 millimeter of wax, the first half millimeter of those grooves are barely starting to touch the original tooth. And remember what I told you, the porcelain, the veneer needs 0.5, 0.6, not discolored, or 0.7, 0.8 if you are more discolored. So look at the preparations at the end. They are not no prep. They're not traditional. You could say they are very superficial traditional preparation. And the beauty is now you have a patient where the veneers are entirely bonded to enamel still, which if you look at the statistics goes to the maximum success. At 10, 15, 20 years, you're going to look at maybe 93% success. You have done the best you could to provide moderate canine guidance. You need to give him back his canine protection. You're going to harmonize your protrusion. That's all you can do occlusal-wise. And also, the patient has to commit to a night guard. So I want to call that the additive veneer preparation. This is what I like to call limited treatment level 1, and that is you are limited in your ability to do comprehensive treatment, but you can still protect the patient and deliver the aesthetics to a great degree. So the formula is based on, for those high function patients, we do not use at all feldspathic porcelain veneers. We use lithium disilicate veneers because they're more rigid. We maintain the enamel, and that bond is your protection for the long term. And it can only happen predictably if you augment the volume. And finally, make sure that the patient wears the occlusal guard, otherwise you increase the risk. So this is the philosophy that we have used in our center. This is the Center for Aesthetics and Implants at the Georgia Dental College at Augusta University. And I really would like to give credit to the 7 people that you see on this screen. Our 4 fellows, Amy Kamba, Sergio Arias, Alvaro Blasi, and Marco Tadros. Our co-director of our center, Dr. Jimmy Londono, who is a prosthodontist, and our master ceramist, Aram Torosian and Im Sang. And with this, I want to thank you for your attention.